Imagine this: you wake up in the morning feeling just a little more tired than usual. You notice your shoes fit a bit tighter, and there's a slight swelling around your ankles. You shrug it off, thinking, "I must have walked too much yesterday." Later in the day, you climb a small flight of stairs and suddenly feel out of breath, your heart pounding faster than normal. Again, you dismiss it: "Maybe I'm just getting older." But what if I told you? These tiny, everyday discomforts could actually be early warning signs of heart failure? Yes, heart failure, a serious condition where your heart struggles to pump blood effectively. Here's the scary part. Most people ignore these subtle clues until it's too late. By the time they seek medical help, their heart is already severely damaged. And every year, millions of people, especially seniors over 60, are rushed to hospitals because they didn't recognize these signals early enough. The truth is, your body often whispers before it screams. Those small changes in your energy, breathing, or even your bathroom habits can reveal exactly what's going on with your heart. But you have to know what to look for. In today's video, we're going to uncover 13 early signs of heart failure that you might be ignoring right now. Some of these signs are so common that people mistake them for normal aging, stress, or fatigue. But missing these red flags can cost you your independence, or even your life. And here's why you need to pay attention. When heart failure is caught early, it can often be managed or even reversed with lifestyle changes, proper treatment, and the right care plan. But if you wait until symptoms become severe, the road to recovery becomes much harder. So grab a notebook, sit back, and really listen, because this information could save your life or the life of someone you love. Let's dive in and explore the first hidden sign of heart failure you should never ignore. Heart failure might sound like a sudden, dramatic event, but in reality, it often develops slowly and silently over time. It's not about your heart stopping completely, that's cardiac arrest. Instead, heart failure happens when your heart can't pump blood as effectively as it should. This means your body isn't getting enough oxygen and nutrients to function properly, leading to fatigue, swelling, and other serious health problems. Here's the thing most people don't realize. Heart failure is extremely common, especially among seniors. According to medical research, nearly 6.7 million adults in the United States are currently living with heart failure, and the numbers are rising each year. Many cases go undiagnosed until the condition becomes severe because the early signs are easy to dismiss as normal aging or minor health issues. The risk increases dramatically with age. After the age of 60, even small lifestyle factors, like a poor diet, lack of exercise, or untreated high blood pressure, can start putting tremendous strain on your heart. Over time, this weakens the heart muscle, setting the stage for heart failure. But here's the good news. If you recognize the warning signs early, you can take steps to slow down or even prevent further damage. Early detection can mean the difference between living a full, active life and facing repeated hospital visits or life-threatening complications. In this video, we're going to go step by step through 13 early symptoms of heart failure that often fly under the radar. These aren't just textbook medical terms, we'll break them down in simple language, so you'll know exactly what to watch for in yourself or a loved one. Some of these symptoms may surprise you. Others might seem unrelated to your heart, but together, they form a clear picture of what's happening inside your body. Stay with me until the end, because the last few signs are often the most overlooked, and knowing them could truly save a life. Now, let's start with the first subtle yet serious clue your body might be giving you. The first early sign of heart failure is unusual fatigue that just doesn't go away. We all feel tired sometimes, especially as we age, but this kind of fatigue feels different. It's not just a little sleepy in the afternoon, it's a deep, heavy exhaustion that lingers no matter how much you rest. You might notice that simple activities like brushing your teeth, taking a shower, or cooking a meal suddenly feel overwhelming. This happens because when your heart isn't pumping well, less oxygen-rich blood reaches your muscles and organs, making everything feel like a huge effort. Many people dismiss this as just getting older, but persistent, unexplained fatigue is a red flag you should never ignore. If you feel like you've lost your spark and can't figure out why, it's time to check your heart. Another often overlooked warning sign is shortness of breath, especially when you're doing something that never used to bother you. Maybe you've noticed that walking across the room, climbing a few stairs, or even lying flat in bed makes you feel breathless. Some people find they have to prop themselves up with extra pillows at night just to breathe comfortably. This happens because fluid can build up in the lungs when the heart can't pump efficiently, making it harder for you to take deep breaths. If you've noticed that you're huffing and puffing during normal activities, or you wake up gasping for air at night, your heart may be trying to send you an urgent message. Next, pay attention to swelling in your feet, ankles, or legs. Many people think a bit of swelling is harmless, especially if they've been standing or sitting for a long time. But when it becomes a daily occurrence, or when your shoes start feeling tighter for no reason, it could be a sign of fluid retention caused by heart failure. This swelling, known as edema, happens because your heart isn't pumping strongly enough to keep blood moving efficiently. As a result, fluid begins to pool in the lower parts of your body. If you notice deep impressions on your skin after taking off socks or shoes, or if your legs feel heavy and puffy, don't ignore it. This is one of the clearest visible signs that something may be wrong with your heart. Rapid weight gain over just a few days can also signal early heart failure. We often think of weight gain as being tied to diet, but when it happens suddenly, like gaining 2 or 3 pounds overnight or 5 pounds within a week, it usually means your body is holding on to fluid. This kind of weight gain isn't from fat, it's from water that's building up because your heart isn't pumping well enough to remove excess fluid. Doctors often tell patients with heart problems to weigh themselves daily because those sudden changes can be an early warning sign of trouble. If your weight is climbing quickly without any changes to your eating habits, it's time to take a closer look. Persistent coughing or wheezing is another symptom people rarely connect to heart failure. Many seniors assume a chronic cough is just allergies, asthma, or the result of aging lungs, but heart failure can cause fluid to back up into the lungs, leading to a wet, phlegmy cough. Some people even notice that the mucus they cough up has a pink or blood-tinged appearance, which can be a serious sign of fluid and blood mixing in the lungs. This symptom often gets worse when lying down or at night, disrupting sleep. If your cough seems to stick around no matter what you try, and especially if it's paired with shortness of breath, it's worth getting your heart checked. Another subtle sign is loss of appetite or feeling full very quickly, even when you haven't eaten much. When your heart is struggling, blood flow to your digestive system can decrease, making it harder for your body to digest food properly. This can lead to nausea, bloating, or a feeling of fullness after just a few bites. Over time, this can cause unintentional weight loss and malnutrition, which can weaken the body even more. Many seniors brush this off as a sensitive stomach or a normal part of aging, but in reality, it could be your heart signaling distress. Watch closely for confusion, memory problems, or difficulty concentrating. These changes can be particularly sneaky because they're often mistaken for early dementia or simply senior moments. When the heart isn't pumping enough oxygen-rich blood to the brain, it can affect your thinking and memory. You might notice that you're forgetting things more often, having trouble following conversations, or feeling disoriented, especially when you stand up quickly. If you or a loved one seem unusually forgetful or confused, it's important to consider that the issue might be more than just aging. It could be related to heart function. Frequent nighttime urination is another surprising sign. You might think getting up several times during the night to use the bathroom is just part of getting older, but it can actually indicate that your heart isn't circulating blood properly during the day. When you lie down at night, excess fluid that has built up in your legs and feet returns to the bloodstream, prompting your kidneys to work harder and produce more urine. If you find yourself waking up multiple times each night, and it's interfering with your sleep, this could be an early indicator of heart trouble. Many people also experience unexplained dizziness or lightheadedness, especially when standing up quickly or after mild exertion. This happens because the brain isn't getting enough oxygen due to poor circulation. It can feel like a brief moment of spinning or like you might faint. While occasional dizziness can have many causes, frequent episodes, particularly when combined with other symptoms, should be taken seriously. For seniors, this symptom is especially dangerous because it increases the risk of falls and injuries. Another common but overlooked sign is chest discomfort or pressure. Notice I didn't say sharp pain. Many people expect heart problems to feel like a dramatic, stabbing pain, but in heart failure, it's often more subtle. It may feel like tightness, heaviness, or a squeezing sensation in the chest, especially during physical activity or times of stress. Some people describe it as if someone is sitting on their chest. While chest discomfort can also be related to other conditions, such as acid reflux, it's crucial to treat it as a warning sign until proven otherwise. Rapid or irregular heartbeat, also called palpitations, can also point to early heart failure. You might feel your heart racing, fluttering, or skipping beats, even when you're at rest. This happens because a weakened heart works harder to pump blood, leading to irregular rhythms. While occasional palpitations can be harmless, frequent or intense episodes should never be ignored, especially if they come with dizziness or shortness of breath. This symptom often indicates that the heart is under significant stress and struggling to keep up. Watch for cold hands and feet that don't seem to warm up, even in a comfortable environment. Poor circulation caused by a weakened heart can make extremities feel icy or numb. You might also notice that your skin appears pale or bluish, particularly around the lips or fingertips. This happens when the blood isn't carrying enough oxygen. While it might seem like a minor annoyance, this symptom reveals that your heart is having trouble delivering blood throughout your body. Finally, one of the most overlooked signs of heart failure is general weakness and decreased exercise tolerance. You might notice that activities you once enjoyed, like gardening, walking the dog, or dancing, now leave you feeling drained. This isn't just about losing stamina with age. When the heart is weak, muscles don't get enough oxygen, making even mild activity exhausting. Over time, this can create a cycle where you move less, become weaker, and place even more stress on your heart. Each of these 13 signs might seem minor on its own, but when they appear together, or if you notice them worsening over time, they paint a clear picture of early heart failure. The key is to listen to your body and act quickly. Don't wait until symptoms become severe or life-threatening. Early detection and treatment can significantly improve your quality of life and even extend it. Taking care of your heart goes beyond simply recognizing the warning signs of heart failure. It's about making consistent, smart choices that support your heart's health every single day. Many seniors think that once heart problems begin, there's nothing they can do, but that couldn't be further from the truth. Even small lifestyle changes can slow down disease progression, reduce symptoms, and dramatically improve quality of life. Here are some powerful, research-backed tips that you can start using right now to strengthen your heart and keep it functioning at its best. One of the most impactful things you can do is stay physically active, but in a way that is safe and sustainable. Many people hear the word exercise and immediately picture intense gym workouts or running miles on a treadmill. For seniors, exercise doesn't have to be extreme to be effective. Gentle, consistent movement is the key. Aim for activities that you enjoy and can maintain, like walking, light cycling, dancing, or swimming. Walking is especially beneficial because it improves circulation, strengthens the heart muscle, and supports healthy joints without being overly stressful on the body. Start small if you need to. Even 10 minutes of movement, 2 or 3 times a day, can make a big difference over time. Gradually increase the duration and intensity as your stamina improves. Include balance and flexibility exercises like stretching, yoga, or Tai Chi. These reduce the risk of falls and improve overall mobility, which is critical for independence as you age. If you have mobility issues or chronic pain, talk with your doctor or a physical therapist about safe, modified activities. Remember, the goal is consistency, not perfection. Moving a little every day is far better than doing nothing at all. Next, focus on smart nutrition habits that fuel your heart and body. We've already discussed the basics of a heart-healthy diet, but let's go deeper into practical tips. Try to follow the 80-20 rule. This means eating nourishing, whole foods 80% of the time while allowing room for small indulgences 20% of the time. This balanced approach prevents feelings of restriction and makes it easier to stick with your plan long-term. Base your meals around colorful vegetables, lean proteins, healthy fats, and whole grains. Foods like berries, leafy greens, beans, lentils, avocados, and salmon are especially beneficial for heart health. When shopping for groceries, read labels carefully. Avoid products with high levels of added sugars, sodium, or artificial ingredients. A good rule of thumb: if you can't pronounce most of the ingredients on the label, it's probably best to skip it. Another powerful tip is meal planning and preparation. When you take time to plan your meals for the week, you're less likely to reach for unhealthy convenience foods. Cooking at home also allows you to control portion sizes and salt levels, which is crucial for managing blood pressure and fluid retention. Don't forget about hydration. Many seniors underestimate how important water is for heart health. When you're dehydrated, your blood thickens, which forces your heart to work harder. Aim to drink water regularly throughout the day, even if you don't feel thirsty. Herbal teas and water-rich foods like cucumbers and watermelon can also help keep you hydrated. Limit alcohol consumption, as excessive drinking can raise blood pressure and weaken the heart muscle. If you do drink, keep it moderate, no more than 1 drink per day for women and 2 for men. Stress management plays a surprisingly large role in protecting your heart. Chronic stress raises levels of hormones like cortisol and adrenaline, which over time can damage blood vessels and increase inflammation in the body. Seniors often face unique stressors, such as health concerns, financial worries, or the loss of loved ones. That's why it's essential to build healthy coping strategies. Deep breathing exercises are a simple yet powerful way to calm your nervous system. Try inhaling slowly through your nose for 4 seconds, holding for 4 seconds, then exhaling through your mouth for 6 seconds. Just a few minutes of this practice can lower heart rate and blood pressure. Meditation, mindfulness, or prayer are other excellent tools for emotional balance. Even 5 to 10 minutes a day can make a noticeable difference. Hobbies are another wonderful stress relief tool. Activities like gardening, painting, or reading not only bring joy but also shift focus away from worries. Equally important is social connection. Loneliness and isolation are linked to higher rates of heart disease and premature death. Make time to connect with friends, family, or community groups. Even phone calls or video chats can provide valuable emotional support. One tip that many seniors overlook is tracking your heart health at home. Simple tools like a digital blood pressure monitor or a daily weight log can provide critical information. Weigh yourself every morning at the same time. A sudden weight gain of 2 to 3 pounds in a day or 5 pounds in a week may indicate fluid retention, which is a sign your heart is under stress. Track your blood pressure regularly and write down the results. Consistently high readings should be shared with your doctor right away. These small habits give you and your healthcare provider valuable insights, allowing for quicker adjustments to medications or lifestyle changes before a problem escalates. Speaking of healthcare providers, regular checkups are non-negotiable. Many heart-related conditions develop silently, with no noticeable symptoms until they've caused significant damage. Schedule routine visits with your doctor to monitor cholesterol, blood pressure, blood sugar, and other vital markers. Bring a list of your symptoms and any questions you have to each appointment. Doctors appreciate when patients are proactive about their health, and this helps ensure you get the most accurate care possible. If you've been prescribed medications, take them exactly as directed. Skipping doses or stopping medications without medical supervision can lead to dangerous complications. If side effects are bothering you, talk to your doctor about alternatives rather than discontinuing treatment on your own. Another often overlooked factor in heart health is quality sleep. Poor sleep, especially conditions like sleep apnea, puts extra strain on the cardiovascular system. If you snore loudly, wake up gasping for air, or feel excessively tired during the day, discuss these symptoms with your doctor. Create a calming bedtime routine, turn off electronics an hour before bed, keep your room cool and dark, and avoid heavy meals or caffeine in the evening. Aim for 7 to 9 hours of restorative sleep each night. If you're carrying extra weight, focus on gradual, sustainable weight loss. Even a small reduction in weight, just 5 to 10% of your body weight, can significantly lower blood pressure and reduce stress on the heart. Avoid crash diets or extreme restrictions, as these can backfire and harm your metabolism. Instead, focus on long-term, balanced habits like eating smaller portions, reducing sugary drinks, and staying active. Celebrate progress along the way. Every pound lost is a victory for your heart and your overall health. One area that often surprises people is the connection between oral health and heart health. Gum disease and poor oral hygiene have been linked to increased risk of heart disease. Bacteria from the mouth can enter the bloodstream and cause inflammation in the heart and blood vessels. To protect yourself, brush and floss daily, and visit your dentist regularly. This simple habit supports both your smile and your cardiovascular system. Finally, make time to listen to your body. Many seniors ignore symptoms because they don't want to be a burden or because they believe discomfort is just part of aging. But your body sends signals for a reason. If you experience persistent fatigue, unusual swelling, shortness of breath, or any of the other signs we've discussed, take it seriously. Seek medical attention early rather than waiting until symptoms become severe. Remember, catching a problem in its early stages gives you a much greater chance of reversing it and protecting your long-term health. These additional tips may seem simple, but when combined, they create a powerful defense system for your heart. By staying active, eating well, managing stress, staying connected, and working closely with your healthcare team, you can dramatically reduce your risk of heart failure and live a vibrant, fulfilling life. Your heart works tirelessly for you every day. Now it's time to return the favor by giving it the care it truly deserves. The journey to heart health doesn't have to be overwhelming. Start small, stay consistent, and remember that every positive choice you make today is an investment in a healthier, stronger future. We've covered a lot of ground today: 13 subtle, often overlooked signs of heart failure and powerful, practical steps you can take to protect your heart. By now, one thing should be clear: your body is always speaking to you. The challenge is learning how to listen before it's too late. Heart failure doesn't happen overnight. It's a slow, gradual process that begins with tiny changes so small they're easy to dismiss. Maybe it's a little extra swelling in your ankles, a sudden need to catch your breath after walking across the room, or a cough that just won't go away. On their own, these things might not seem alarming. But together, they form a pattern, a story your heart is trying to tell you. The earlier you recognize that story, the better your chances of rewriting it. The good news is that you are not powerless. Even if you've been diagnosed with early-stage heart failure, there is so much you can do to slow its progress, reduce your symptoms, and even regain strength. Small, consistent actions, like eating a balanced diet, moving your body every day, managing stress, and getting quality sleep, can transform your heart health. These aren't quick fixes or gimmicks, they're lifestyle habits that build a foundation for lasting wellness. I want you to remember something very important: early detection saves lives. If you've recognized one or more of the signs we discussed in yourself or a loved one, don't wait. Make an appointment with your doctor. Bring a written list of your symptoms, even if they seem minor. Doctors rely on your observations to make accurate diagnoses, and catching heart failure early makes all the difference in treatment success. And please, don't let fear or denial hold you back. Many people avoid seeing a doctor because they're afraid of what they'll hear, but knowledge is power. By facing the truth head-on, you give yourself the best possible chance of taking control of your health. Remember, it's much easier to manage heart failure when it's detected early than to treat it once it's advanced. Your heart is an incredible organ. From the moment you were born, it has never stopped working, not for a single second. It has carried you through joy, pain, laughter, and tears. It deserves your care, your respect, and your attention. Think of every healthy choice you make, every walk, every nourishing meal, every moment of gratitude, as a way of saying thank you to your heart for its lifetime of service. Before we wrap up, let me leave you with a simple, 3-step action plan you can start today. Step 1. Pay attention to your body. Notice changes in your energy, breathing, weight, or mood. Write them down. Step 2. Take proactive steps to strengthen your heart through diet, movement, stress management, and routine checkups. Step 3. Share this knowledge with others. Someone you know might be experiencing these symptoms right now without realizing what they mean. By sharing this video, you could save a life. If this video resonated with you, please take a moment to like, comment, and subscribe to our channel. Your support helps us continue creating valuable content to guide seniors and their families toward healthier, more fulfilling lives. If you have a question about any of the signs or tips we discussed today, leave it in the comments below. I read every single one, and I'd love to hear your story or answer your concerns. Finally, remember this: you are never too old and it is never too late to make positive changes. Whether you're 60, 70, or even 90, your heart responds to care and attention. Every step you take today, no matter how small, moves you closer to a future filled with vitality and joy. So, take a deep breath, make a commitment to yourself, and start right now. Your heart has been fighting for you since day one. Isn't it time you fight for it, too? Thank you so much for watching. Stay strong, stay informed, and take care of that amazing heart of yours. I'll see you in the next video.